Great, thank you very much. I'm really glad that the committee has set aside a panel to discuss this really important topic of anti-bullying legislation. We've already heard from several of the panelists yesterday alluding to the issues of policy and the broader role that politics is playing in this. So it's great to be here and have a chance to talk to you about some of the research evidence. In the case of this field, certainly much more in terms of the knowledge gaps about the effectiveness of anti-bullying legislation and reducing bullying and related behaviors. So as many of you are aware, there's been real rapid expansion and proliferation of anti-bullying legislation in the United States. These data here show that between the years of 1999 and 2010, more than 120 bills on bullying and related behaviors have been either enacted or amended in state legislatures. In terms of the prevalence of anti-bullying laws in the U.S., before the year of 2003, only 15 states had anti-bullying legislation, so fewer than a third of the states. But a mere 4 years later, 35 states had anti-bullying laws. And then most recently, now in 2014, as has already been stated, 49 out of the 50 states have anti-bullying laws. And in fact, Montana, that doesn't have a law, does have an anti-bullying policy. So given the proliferation of anti-bullying legislation, scholars have begun to develop conceptual frameworks for understanding the actual content of anti-bullying laws and policies, as well as their scope. And I've shown here three of the most prominent frameworks that have been developed, including the most recent and comprehensive framework that was developed for the U.S. Department of Education. And I'm showing here data that was compiled for this Department of Education report. This report evaluated state anti-bullying policies through April 30th of 2011. And at that time, 46 states had passed anti-bullying laws. You can see here on the y-axis are the 16 key elements that were identified in this report. So some of these elements include things like whether or not specific groups are enumerated in the policy, whether or not bullying is actually defined in the law, and if it is, how it's defined and what behaviors are included, and also things like whether or not the law or policy is actually communicated to school administrators, to teachers and students. On the y-axis, on the x-axis here is the number of states, and again, at the time this report was released, there were 46 states that had laws. And you can see here that some key components are included in legislation much more frequently in some states than in others. So for example, if you look up here, 43 states had descriptions of bullying behavior that's prohibited in their legislation, but in contrast, only 17 states had enumerated groups that were protected in their policy. And another key finding to emerge from this report is there's substantial variation across states with respect to the number of key components that are included in their legislation. So of the 46 states that had anti-bullying laws at the time the report was released, only 2 had all 16 of these components in their policies. It's also the case, you can see here, that about a third of the states had between 13 to 16 components in their legislation, but it's also the case that about a third had fewer than half of these different components in their policies. So the vast majority of research attention on anti-bullying legislation has really focused on legal content analyses of these policies. We know very little about the extent to which these policies are actually effective in meeting their stated goal, that is to reduce bullying and related negative outcomes among youth. And Limber and Small, in their paper, in 2003, a review paper of these policies stated that, quote, "The question of whether state laws can provide a useful vehicle for reducing bullying behavior among children remains unanswered," end quote. And in many respects, this statement remains true nearly a decade later. So to begin to address this gap in the literature, my colleague and I conducted one of the first studies, empirical studies, to look at the effectiveness of these policies. And in this study, we were interested in whether having an inclusive anti-bullying policy, that is a policy that specifically includes sexual orientation in the list of protected class statuses, is effective in reducing suicide risk and peer victimization among lesbian and gay youth who are disproportionate risk both for bullying and for suicide attempts. So to do this, we used data from Oregon. We looked at the proportion of school districts that had these inclusive anti-bullying policies in 34 counties in Oregon. And to do that, we went to the student school district handbooks and coded whether or not at the district level they had an inclusive anti-bullying policy. Again, that is a policy that specifically includes sexual orientation as a protected class status. We did this in 197 school districts. And then we aggregate that data up to the county level. So essentially, each of these different counties receives a score based on the proportion of the school districts within that county that had these inclusive anti-bullying policies. And based on what I said earlier, it probably won't be surprising that there's substantial heterogeneity or variation across these different counties with respect to whether or not they had these inclusive anti-bullying policies. So 15% of these counties had 0 of their school districts with an inclusive anti-bullying policy. 18% had fewer than half of their school districts with one of these inclusive anti-bullying policies. And finally, only 15% of these counties had a school district with 100% of their schools having inclusive anti-bullying policies. So then we were fortunate enough to have access to a data set where we could link this ecologic data on the prevalence of anti-bullying policies at the county level to individual level health outcomes among lesbian and gay youth who live in those different counties. And we were able to do that with a data set from Oregon called the Oregon Healthy Teen Study. This provided information on health, sexual orientation, and fortuitously also the counties where the kids lived in. And so that enabled us to link this policy level information to this data set. These are annual probability-based surveys are representative of Oregon's 11th grade public school students, and they're modeled on the YRBS data sets that were designed by the CDC to measure the leading causes of morbidity and mortality among youth. So these are the data here. On the y-axis here is the prevalence of suicide attempts in the past year, and on the x-axis is that inclusive anti-bullying policy variable that I just mentioned. And we divided this into tertiles, ranging from the least inclusive counties to the most inclusive counties. So we operationalized the most inclusive counties as those that had the greatest proportion of their school districts with these anti-bullying policies that specifically include sexual orientation. And then what we did is just simply look at what's the prevalence of suicide attempts among lesbian and gay youth within each of these tertiles. And here are these results. So you can see substantial variation in a level of suicide attempts as a function of living in these different counties. So we find that 31% of lesbian and gay youth living in the least inclusive counties had attempted suicide in the past year, compared to only 16% living in the most inclusive counties. And our odds ratios indicate that lesbian and gay youth are over 2 times more likely to have attempted suicide in the past year if they lived in one of the less inclusive counties compared to the most inclusive. And these results remain robust when we adjust for several different covariates at both the individual and the county level. I want to quickly mention a couple additional results in this study. First is we were able to code these policies in a couple different ways. So first is we could, of course, look at whether or not there was actually an anti-bullying policy or not. But secondly, we were able to see whether or not the anti-bullying policy enumerated specific groups. So that is, either they didn't enumerate groups at all, or if they did, they listed several different groups but did not specifically include sexual orientation. And then finally, again, we were able to look at whether or not they did include sexual orientation in their list of protected class statuses. And I think one of the more interesting findings to emerge is that we find that policies that do not include sexual orientation as a protected class are not protective of lesbian and gay youth in terms of reducing the risk of suicide attempts. So the policy specifically has to include this group in its enumerated list in order to exert this protective effect. There's, of course, a lot of controversy right now over enumerated groups in the United States, and although our results certainly can't speak to all aspects of these controversies, they are suggesting, at least in a preliminary way, that some of these enumerated groups may be important in sort of marking an inclusive school climate particularly for vulnerable youth like sexual minorities. The other thing we're able to document in this study is that these inclusive anti-bullying policies were also associated with a reduced risk for peer victimization for all youth, including LGBT youth as well as heterosexual youth. And although the Oregon Healthy Teen Study doesn't include a specific measure of bullying, these results are also suggestive that these inclusive anti-bullying policies may be effective in reducing various forms of peer aggression, including bullying, although that needs to be replicated in a sample that actually includes measures of bullying behaviors. I also want to very briefly mention that these findings in terms of the relationship between bullying policies and bullying behaviors are very consistent with several studies that my colleagues and I and others have done showing that social policies surrounding LGBT populations can, in very powerful ways, shape their health and well-being. So there's certainly precedence in the literature showing that social policies can have important downstream health consequences. So as I mentioned, there's a lot that we don't know about anti-bullying policies and bullying behaviors, and so I'm going to outline several important gaps that need to be addressed in future research. First is we need a lot more research on the actual effectiveness of anti-bullying policies in reducing bullying behaviors in order to establish best practices for policymakers and also for school administrators. To do this, we need to be using stronger methodologies for establishing causal inferences. So in many cases, it's unethical to randomly assign individuals to live in environments with or without an anti-bullying policy, so randomized controlled trials aren't possible, but we can certainly do studies like longitudinal and quasi-experimental studies that can also be used to establish causal inferences about the relationship between anti-bullying policies and bullying behaviors. We also need to be taking advantage of the heterogeneity in terms of the comprehensiveness and expansiveness of these anti-bullying policies to test dose-response relationships, which can also give us some leverage in terms of causal inference. So what I mean there is that we can examine whether or not anti-bullying policies are effective in reducing bullying behaviors. And if that is the case, we should see these relationships much more strongly in states that have more expansive and comprehensive anti-bullying policies compared to those with less expansive policies. And then finally, if we continue to find that these anti-bullying policies are effective in reducing bullying behaviors, we need to be testing mediators to understand why it is that these policies are effective. We've heard a lot about changing social norms in schools, and it may be possible that these anti-bullying laws are changing social norms around bullying behaviors. And we also need to be testing moderators to understand the groups for whom these policies are most effective, and conversely, maybe groups for whom these policies aren't effective, in which case we need to be designing other policies or interventions. And then secondly, we need much more research on understanding implementation effects. So you can have a policy on the books, but whether the extent to which it's actually changing behaviors on the ground can be a very different story. And so we really need to be understanding how these anti-bullying laws are implemented on the ground in schools, and in particular to identify barriers and facilitators for these implementation effects. And I think here qualitative research and ethnographic research in schools with administrators and teachers and parents and youth can be particularly helpful. So to end, I want to talk just very briefly about some ongoing research that is beginning to address some of these critical gaps, given that there's so much that we don't know about the effectiveness of these policies. One is a study that the Robert Wood Johnson Foundation has funded to my colleague Marison Ramirez at the University of Iowa. She's doing a mixed method study that's looking at both outcome and implementation evaluations in Iowa using a quasi-experimental design to assess the impact of this legislation on bullying behaviors, but then she's also doing qualitative interviews in the schools with administrators to understand some of the barriers and facilitators to how this law is being implemented on the ground. And then Dr. Ramirez and I also have a grant from Columbia CDC funded Injury Center to again use a mixed methods approach to do some legal content analyses of anti-bullying legislations in several key regions in the US that are shown here. And then we're linking that data to the youth risk behavior surveillance studies to examine again whether or not the strength of these anti-bullying laws is effective in reducing bullying behavior. So I'll end there and thank the committee again for the opportunity to speak with you, and I look forward to your questions during the discussion section.